let's talk about colon health. Now, normally we just kind of take this body function for granted unless there's a problem, unless there's pain or constipation or diarrhea or bleeding or a hemorrhoid. Normally we don't really think too much about this body function that occurs regularly. Just let's take a step back with biology. Remember, when we eat food, it goes into our esophagus, to our stomach, gets digested, metabolized. The nutrients go off to the rest of our body to provide fuel. And the waste products travel through the lower intestine and then into the large intestine or the colon, and then they come out the rectum. If you're constipated, you might have a lot of trouble having a bowel movement. It may be very hard, it may take a lot of pressure to push it out, and you may have developed some rectal bleeding or some hemorrhoids. And there's two types of hemorrhoids. There's internal hemorrhoids and external. Internal hemorrhoids are really different than the external ones that you can feel when you wipe after a bowel movement. You know, those are sometimes the size of a BB or a marble or maybe a small apricot. And a lot of people have several hemorrhoids. Many women develop them after pregnancy, after trying to push a baby out. Because hemorrhoids are really a varicose vein of the skin around the rectal opening. And when we push, it makes that vein open up a little bit and it causes it to swell and the tissue around it swells. So there can be external hemorrhoids, which often will bleed and itch and cause pain, but there can also be internal hemorrhoids that are inside the rectal canal that you and I don't know about unless we notice a little bit of pink bleeding or sometimes a little bit of dark coffee ground kind of discharge from the rectum. What's going on with internal hemorrhoids? They don't have the same kind of nerve endings that the external hemorrhoids have. So people oftentimes don't notice, they don't have the pain or the itching. Now they may notice that when they wipe themselves, they feel like something came out, but sometimes it will retract and go back into the rectum. Sometimes it'll stay out and it'll be very, very uncomfortable. And these internal hemorrhoids tend to bleed a lot. Take-home message here is if you're having a lot of pain with bowel movements, if you're having itching, if you notice a lot of bumps around the rectal opening, or you're having bleeding every day and that goes on for more than a week, see your healthcare provider. Those can all be signs of colon cancer. The thing about blood when you wipe yourself is sometimes it'll be a little bit of pink spotting, and sometimes that happens when the skin around the rectum stretches a little bit and tears. And there'll be a little bit of pink spotting and you'll see it 1 or 2 days, but it doesn't go on for days and days or months. If you see a little bit of pink spotting and it goes away, you don't really have to worry about it. But if it doesn't go away, talk to your healthcare provider. If you see coffee ground-like discharge from your rectum and it's not related to your poop, do talk to your healthcare provider. Those coffee grounds are sometimes oxidized or metabolized blood, and that can be a sign that there's bleeding higher up in the colon, and that can be a sign that there's polyps or that there's colon cancer. And of course, if you see something that looks like sludge or dark fudgy material and it's not your stool coming out of your rectum, I don't want you to wait another minute. Go to urgent care or see your own healthcare provider, because those can be signs of colon cancer. And if colon cancer is caught early, it can be treated and people go on to live long, healthy lives. So when we talk about colon cancer, a lot of people talk about colonoscopies and screening tests. If you're a low-risk individual, that means you've never had colon cancer before and you don't have any family history of colon cancer in your immediate family, your parents, brothers or sisters, then you can use the Cologuard home testing. But if you're a high-risk individual, you need to talk to your healthcare provider about whether or not you should have a colonoscopy at age 40 or even earlier, depending on the age of your relative, your close relative who had colon cancer. Colonoscopies have come a long way. So I don't want you to be freaked out about the idea of having a colonoscopy. I've had many myself, and the prep or what you have to do to prepare has changed over the years. And it's much easier now to clean out your colon and be ready for your colonoscopy without having to suffer for 3 and 4 days like in the olden days. Let's talk a little bit about colonoscopies. When a provider, a GI specialist doctor does a colonoscopy, they use a lighted camera and it goes into the rectum, up into the colon to look for any polyps or signs of any cancerous lesions or precancerous lesions. And it can also detect other colon issues. Oftentimes a biopsy will be taken and those tissue samples will be sent to the lab. During a colonoscopy, people are asleep. They don't feel anything. And when they wake up, they typically don't feel any pain. They don't typically have any bleeding, and they can go home, sleep it off for a day, and they get back to their normal activities the next day. Colonoscopies have been shown to help reduce the risk of colon cancer by finding early polyps way before someone ever has a symptom of colon cancer or rectal bleeding. So if you've been told that you need a colonoscopy, maybe it's a screening test at age 50, and maybe you get them every 5 years like I do. It's a really good idea. You'll feel more reassured. Now, what about genetic testing for colon cancer to see if a person's at a higher risk? So there is a syndrome called the Lynch syndrome, and Lynch syndrome is a collection of different types of cancer, including early colon cancer, that's been associated with some genetic mutations. And those same genetic mutations can increase the risk of pancreatic cancer and ovarian cancer, even endometrial or uterine cancer. So if you have a family history of someone in your close immediate family, brother, sister, parent, grandparent, or even a cousin who's had aunts or uncles who've had an early colon cancer, that is before the age of 50, talk to your healthcare provider about whether genetic testing is a good idea for you. Because that genetic testing can help inform you about whether you should have more frequent colonoscopies, more frequent screenings, or whether you can follow a normal routine or a typical routine for screening. So again, genetic testing for the Lynch syndrome has been really valuable in helping people find out if they're at a higher risk and if they should have what we call more added surveillance or more added testing. The other thing to do is to reduce your risk of colon cancer. How do you do that? Well, turns out our colons love fiber. They love raw vegetables, lots of whole grains. They like fruit that's not cooked or smashed up into jam or used in cakes or cookies. Our colons love to have beans. So what we need to do is to help our colons not be constipated, not to be filled up with a lot of highly processed foods, but to use and eat more foods that are like raw vegetables. So here's an easy thing you can do. You can skip the chips and use cucumber slices to dip into salsa or to dip into hummus, which is actually made of beans, and that's loaded with fiber. But the other things you can do is if you are a smoker, you can reduce your smoking or quit smoking. That reduces your risk. If you have a high alcohol intake, reduce that as well. If you're not getting enough exercise, start walking or doing some exercise regularly. That also reduces your risk. And we all know that being overweight adds a lot of extra risks to our heart for diabetes, but it turns out also colon cancer. So I hope this helps understand a little bit more about your colon health, hemorrhoids, when to get genetic testing, and when to have a colonoscopy. If you like this, you can click like and subscribe and leave me a comment below about other topics you'd like me to cover. Take care and be well.